Optex is a Japanese company based in Kobe, Japan. It is run by Joe Yoneda, who's a second generation CEO of this company. And the company has actually been in business since 1981, so very well established in Japan. In 1988, they moved from Tokyo to their current location. So corporate offices in Kobe, the manufacturing unit is in Toyoka, Hyogo, on the other side of Japan. And in 2001, they began the development of some really innovative solutions that are novel, we think, in the world. So the povidone iodine-based systems. And in 2016, they began work in Europe by export originally, and then eventually established the Optex Europe location by purchasing the manufacturer Microlens, who manufactures rigid lenses. So we'll talk to you a little bit about both sides of the business today. Pleased to say that they have MDR approval for all of the products in Europe, which has been a very difficult hurdle for some people. And the company's goal is to provide very high quality ophthalmic products around the world. So the expansion is continuing on a global basis. And again, right now, mostly focused on contact lens care, but in Europe, also expanding into lenses. So you'll see this map here of the countries that are currently covered, but it is expanding on a daily basis almost. So we have Europe, not yet quite in the UK, a very wide presence in Asia as well as Oceania. So we know that contact lenses are a benefit to patients, and we know that the care is very, very important, because contact lens care, when it's not done properly, can lead to infection, can lead to allergy, and also discomfort. So those are the three priorities in developing products at Optex. When you look at contact lens deposits, we know that they can come from lots of places, from the tears, as well as from external sources like skin and cosmetics. So there's a cleaning function that needs to be done to keep lipids and proteins at a minimum. We also have concerns around case contamination. We know that the #1 source of microbes for infections is the contact lens case, as well as water sources. So case contamination is also another focus. And then at the end of the day, patients also have to be comfortable and have clear vision while using their contact lenses and care products. So with that background, I'd like to introduce to you the key systems that are marketed under the Cleardo name in Japan and around the world. So on the left-hand side, we have Cleardo products for soft contact lenses. So there's a povidone iodine-based system, as well as a multi-purpose system that is a dual disinfectant system. On the right-hand side, you see the Cleardo GP, which is the povidone iodine system. And there's a similar system for scleral lenses. The Cleardo for soft contact lenses is composed of a rinsing solution that you add an iodine tablet to it, and that iodine tablet is actually a dry-coated tablet. So the povidone iodine is on the outside. The inner core has the neutralizer as well as a protease, because we know with silicone hydrogel lenses, even though protein amounts are low, the protein deposits on the surface and it becomes easily denatured. So we're going back to worrying about protein again. And then the solution is also used for rinsing of the lenses and the case at the end. So how the product is used is, obviously you're going to wash your hands, you're going to wash the surface of the lens. The lens is going into the lens case along with the iodine tablet. Then it's closed up and it begins soaking. It'll start turning orange. You'll see the iodine, and then as the iodine neutralizes, the solution will become clear. What happens is, with regards to disinfection, is that the outer layer starts to dissolve immediately, and after just a couple of minutes, you'll start seeing the orange color. The orange color increases to a dark, almost a brown color in the first couple of minutes, and that is the full disinfection efficacy that we see. And then as it starts to neutralize, the color will begin to fade. So after about 10 minutes, but certainly by 20 minutes, the neutralization is complete and the microbial efficacy has peaked. And the next time sitting in the solution is for the protease to continue to work. So it's actually quite a fast disinfection, but there's a 4-hour storage to allow the whole system to clean and disinfect. The rigid lens solution is very much the same in terms of the ingredients, but the form of the system is different. So in the rigid lens, the povidone iodine is actually in the solution. So when you pour it in the rigid lens case, it'll immediately be yellow. And you also add the tablet. In this case, the tablet is the neutralizing tablet. And again, the lid is closed and it's stored for 4 hours. And what you see here is because we start with full strength povidone iodine, you have immediate disinfection beginning. And then as the neutralization tablet dissolves, you start neutralizing that iodine and it will eventually become clear again after about 15 minutes. And then you leave the lenses soaking in the system for another 4 hours, and that completes the cleaning activities as well. And at the end of that time, you're going to be rinsing the lens and then placing it on the eye. The scleral lens system, Clearview SL, is the same as the GP system, except the case has been modified to allow placement of a larger diameter lens, but the process is exactly the same. All right, so we have Ousman, who's going to walk us through some of the products that we have for Optex Europe. So I'll introduce Ousman to continue.
Thank you, Chris, and welcome everyone. And for now, I would like to talk about the products that we have at our main office at Optex Europe. And in combination with the Clearview, we also have state-of-the-art contact lenses. And these are our micro lens contact lenses. They are custom-made contact lenses. And we have these contact lenses available in rigid gas permeable. We have them in soft contact lenses and also in scleral contact lenses. And our Clearview product, as rightfully mentioned by Dr. Schnider, it's a very unique care product with a very superior qualities. And it works with all kinds of soft contact lenses and also rigid gas contact lenses. And at Optex, we have products ranging from gas permeable lenses, soft contact lenses, soft and hybrid lenses. And part of our rigid gas permeable lenses is our wonderful aspheric lenses, that is the Asphereflex, which you can have in spherical, in toric, bifocal and multifocal contact lenses. And if you have patients that have astigmatism of the 2 diopters, this is a lens that is well indicated for those kind of patients. And for some other patients with high astigmatism, we strongly recommend the Eclipse contact lenses that we have. We also have lenses for other designs like Flexi, Tetra. This depends on how irregular the cornea is. And these lenses, you can have them in different kind of materials. And this material ranges from different DK by 2. And for our soft lenses, we have soft lenses indicated for keratoconus. So if there are some patients that do not fit well with the rigid gas permeable lenses due to comfort issues, we strongly advise them to use this micro lens RX for soft. And we have them in all possibilities ranging from spheric, toric, multifocal and multifocal toric contact lenses. And for the scleral contact lenses, it is very easy to fit. In 7 steps you can fit these contact lenses, and you have the possibility to have them in a full scleral contact lenses with diameters ranging from 18 millimeter to 23, sorry, and for the mini scleral lenses from 16 to 17.5. And these are the delivery options that we have for our MESA contact lenses, and you can play with different kind of volt height and landing zones and the haptic toric options that you have. And for the hybrid lenses, we are exclusive distributors of these lenses from Synergized, and we have the Synergized A lenses, which are indicated for astigmatism, presbyopia and for irregular corneas. And we have lenses that are very, very well effective for patients with very high astigmatism, for example the duet lenses, the Synergized A, and the Ultra Health and Ultra Health FC for patients that has undergone the refractive surgeries. And in combinations with our lenses and the care solution that we have, we strongly recommend that these lenses for the soft contact lenses to be used with Clearview SL and MPS, which is a dual disinfectant system. Highly effective, and it has a good surface wettability when you use this care product to treat your contact lenses. And for the GP lenses, we strongly recommend that people use them in combination with Clearview GP. Clearview GP is a PVPI based system, povidone iodine based system, which is known to have a very strong disinfectant efficacy and ensure safety and remove the lipids and proteins. And for the scleral lenses, we have the Clearview SL, and which is this PVI, also povidone iodine disinfecting based system, which you have the Clearview SLI to use as insertion and rinsing solution. So basically, our care product comprises of all the ranges that you need for scleral lenses, for GP lenses, and for the soft contact lenses. So it's a complete product portfolio which you can have delivered to you. We are present in so many European countries. That is normally in Belgium, Spain, France, and in the Oceania we are also there. And in Asia, you can also have our products there. So if anybody is interested to know more about our products, I strongly recommend you to visit our website and or try to contact us at our stand space there, number 21, at the main entrance. So we thank you for listening and enjoy the rest of the exhibition.